Hey, yo, it's 2024, and I'm finally getting back into the podcasting arena. I've been running a few of my own redos on topics that I think are super important that I get a lot of requests on. But something that has been coming up over and over and over again is women getting confused, lied to, or basically just told horrible amounts of misinformation about estrogen and progesterone, specifically estradiol and micronized progesterone. And they're getting confused because they're kind of doctors act like synthetics, ethinylestradiol and progestins are the same thing. And they're not. They're not even remotely the same. It's not even like comparing apples and oranges. It's like comparing apples and cars. It's so different, and yet my colleagues piss me off over and over again because they are basically acting like it's the same. And somebody said to me today, a provider on Instagram, we really need to make a stand and we need to explain that these things are no longer the same, and we need to stop this misinformation that is getting out there to women. And it really struck a chord with me because I'm like, you know what? You're right. We should be doing this. So what I wanted to do today was take kind of a quick but deeper dive for you, the listener, who may be confused about hormones, about estradiol, progesterone, estrogen, or ethinylestradiol, and micronized progesterone or progestins, because it can be freaking confusing. And so let's look at synthetic estrogens first. Now, synthetic estrogens, my colleagues might argue, all hormones are technically synthetic because you have to make them in a lab. And I think that what I'm trying to say is that when you have a situation where we are saying synthetic, what we mean are old school hormones that were made 30, 40 years ago that kind of fit the receptor, but might hit it actually too hard and don't quite fit the receptor like a bioidentical hormone would fit. Now, the word bioidentical, controversial. I don't know why, but it is. NAMS, the North American Menopause Society, has long decided that they hated the word bioidentical. However, in the last 15 years, miraculously, they've come around and decided that, well, these hormones, these bioidentical hormones, are actually great. It's amazing how their turnaround, Wolf Utian, who used to be the president of NAMS about 12, 15 years ago, said that they were a scam, that they were horrible. Now, he's subsequently written a book about how awesome they are. And it's amazing how this turnaround has happened when big pharmacy started making bioidentical hormones. So when I say bioidentical versus synthetic, what I mean is that they look like your body's natural hormones. Exactly. They don't have added carboxyl groups or methyl groups or any sort of group attached to them that they can patent. See, this is the problem with bioidentical hormones. You can't patent them because they're naturally occurring, but they can patent a progestin, they can patent a synthetic estradiol, and that's what they've been doing for decades, which is one of the reasons they didn't like the bioidentical hormones being compounded, is because they can't control them and they lose a lot of money. So obviously it always comes down to money. And if you want to look at monies, look at statins and red rice yeast and what happened there. That's a whole different story. But suffice it to say, my friends at NAMS hated the word bioidentical. So what did my colleagues do? Well, they invented their own word. They now call these body identical. You see, body identical is fine, but not bioidentical. I mean, come on, guys. Why do we have to be such assholes, such insecure assholes as doctors. It's like bioidentical has been used for decades, and they just had to make up their own damn word because we're so effing insecure as physicians that we just wanted to come up with our own word. It's the same damn thing, people. Anyways, I'm not a huge fan of NAMs because I think that they're training people in the old school ways of hormone replacement. So anybody that's gotten a NAM certification, sorry, but you still don't quite get it. Anyways, different story. Actually, I should do a podcast on the North American Menopause Society at some point. So let's get into it. Let's get into synthetic estrogens. Synthetic estrogens have been used for menopause estrogen replacement, including ethinylestradiol, C3 methylated derivative, mestranol, it's cyclophenyl ether, quinesterol, and diethylstilbestrol, which, if you talk to your grandmothers, diethylstilbestrol was used wantonly 50 years ago, and for premature labor. And it's a synthetic estrogen that was used in pregnant women to prevent premature labor. And now we have this horrible history in OB where we have DES babies. They were basically born, these kids were born with, very shortened arms and legs. The process of having this kind of diethylstilbestrol was we're getting ahead of ourselves here, but suffice it to say DES or diethylstilbestrol. Actually, I'm even getting confused here. Sorry about that. Diethylstilbestrol was a I'm going to have you go back and edit this out for me. Can you go back to the point where I started talking about DES and just kind of splice this together because I'm going to talk about DES. So DES, so I'm going to hard stop here. And then I'm going to start back up. DES or diethylstilbestrol is a synthetic estrogen that was made years and years and years ago. And that medication initially had come out because women were having issues with estrogens, and it was prescribed to pregnant women at the time between like 1940 and 1970 to prevent miscarriage and to prevent preterm labor and related complications of pregnancy, is the way they described it. The use of DES declined after 1950s when it showed that it was not effective actually in preventing any of the symptoms, but it was continued because it did stop lactation. So they weren't using it for the deliveries. They were using it for lactation, for emergency contraception, and sometimes to treat menopausal symptoms. So what happened was women that took DES, they had male babies and they had female babies. The female babies ended up having increased risks of certain types of cancers. And we now know that DES has been categorized as an endocrine disrupting chemical. Increased risks of what they call DES daughters had clear cell adenocarcinoma, 40 times the risk of developing clear cell adenocarcinoma of the cervix usually. DES daughters may have had a slightly increased risk of breast cancer after age 40. A 2021 study found that DES daughters had about 2 times the risk of pancreatic cancer and cervical precancer. So DES in and of itself was a bad actor. So that was one of the estrogens that we came up with. This you can fuck around with nature and you get what you get, Ethinylestradiol. So let's talk about ethinylestradiol. This is the estrogen that's used in most oral contraceptives. rapidly absorbed in the gastrointestinal tract after it's consumed orally. If you compare oral and intravenous doses of this ethinylestradiol, so if you look at women that take it orally versus women that take it IV, the oral bioavailability is about 55 to 65%, meaning an oral dose of 50 milligrams of ethinylestradiol usually will result in a blood level of about 400 picograms per ml. That's pretty damn high. Usually when I look at estradiol, different hormone, I usually like to see it somewhere between 60 and probably 120. So a 50 milligram dose. Now this 50 milligram dose of ethinylestradiol was the first round of oral contraceptives. They subsequently decreased to 35, then they went to 30, 20, and now they're usually 10 milligrams. Your oral contraceptives that have a low number or letters in front of them, LO, usually have about a 10 to 20 milligram dose of ethinylestradiol. So the pills themselves are about 1/4 to 1/5 the dosage that they were years and years ago. So they've come down, obviously in the toxicity a little bit, but it still can cause problems. The way these hormones, this ethinylestradiol is removed from your system is by the liver, and you have an enzyme system called the cytochrome P450 enzyme system, which is the way that it gets out of your body, goes through the liver passage. But this is what you need to know. Ethinylestradiol is 75 to 1,000 times more potent per weight than even Premarin. Now, Premarin is another conjugated equine estrogen that was made from horses that was used in women for menopause. And it's per weight 75 to 1,000 times stronger. This is a birth control pill that women take for probably 10 or 20 years of their life. That's how strong this is. Estrone, which is the weakest of the estrogen hormones, or estradiol, basically has similar effects on the body. But if you think about the strength of the oral contraceptives, not near as much. So I want you to understand that these medications, ethinylestradiol, the main form of estrogen that's in a birth control pill, is 75 to 1,000 times stronger than your regular estrogen. And you're taking it not just for a day or two, you're taking it for decades in many cases. You're taking it when you're 55. So here's the thing that's hilarious. My colleagues are afraid of postmenopausal hormone replacement because they're worried about cancer. And yet, they put women on birth control pills. I just had a lady Friday I was talking about on Instagram who is 56 and she's on birth control pills. I had 2 women respond to me. My doctor put me on birth control pills to get me through perimenopause. Well, guess what? You were taking 1,000 times the amount of estrogen that you needed. And this is all from physicians who are also afraid of breast cancer risks. Come on, guys. I mean, if we're going to be hateful of menopause hormone replacement, at least be hateful of all the hormones and not just the ones that you don't understand. It's really embarrassing to me when my colleagues go to extremes. So if you're doing bioidentical, or as my colleagues like to say, body identical, you can do topical creams, sublingual troches, there's vaginal applications. There is even oral estradiol that's generic now. 1 milligrams and 2 milligrams are the only doses available. There's also patches now that are bioidentical. So there's a lot of bioidentical options, even with your insurance. Unfortunately, a lot of insurance companies don't even pay for these. So sometimes getting the prescription at Walgreens or CVS might be a little more expensive based on your coverage than getting a compounded hormone, which probably run about $45 to $55 a month. So let's look real quick then at the progestins. What are the progestins? Well, we've got, well, first of all, before I leave estrogen, let's talk real quick about Premarin, because this ties into the Women's Health Initiative, which, as you know, if you've listened to my other podcasts, was probably the worst study that ever came out in the history of females, because it said there was an increased risk of breast cancer with the pill Prempro, which was a combination of conjugated equine estrogen and medroxyprogesterone, which is Provera. Both horrible medications, in my opinion. Both of them horribly, horribly bad. Combined together, they cause an increased risk of breast cancer. The interesting thing, the Women's Health Initiative did not show an increased risk in breast cancer with just Premarin or conjugated equine estrogen. It was the combination of those two medications, and possibly may have even just been the Provera, for all we know. Premarin, at the time the Women's Health Initiative came out in the mid-2000s, was probably the number one prescribed medication, but it was definitely the number one prescribed orally administered estrogen. Still available to this day. You can get it as a topical cream. You can get it as a pill. Still, I get patients that are on this horrible medicine even now. It's, to this day, you can't find a generic form of Premarin. The reason being is when the patents wear off on these medications, the generic companies will come in and they'll just reproduce it. The problem is the makers of Premarin, which is Wyeth Thirst, they couldn't list all the ingredients because they don't know. They really have no idea all of the things. I think the last time I saw a list, there was like 32 ingredients in Premarin, and they just didn't understand what was in it. So it never came off patent because it couldn't be reproduced. So it's a complex of sodium salts and 3 conjugated estrogens. Estrone sulfate, which is about 50% of the pill. We also know that estrone is usually the cause of breast cancer. If you're looking at one of the estrogen bodies, estradiol, estriol, and estrone, estrone is the worst of the 3 because your body tries to clear that and it might turn it into 4-methoxyestrone, which is carcinogenic. So we don't want estrone, but 50% of the pill is estrone. And then 2 unique horse estrogens, equilin sulfate and equilinin sulfate. So there's also 17-beta estradiol sulfate, 17-alpha estradiol sulfate, 17-beta dihydroequilin sulfate, 17-alpha dihydroequilin sulfate, and then 17B dihydroequilin, and 17-alpha dihydroequilinin. There's also 8-estrone sulfate, a bunch of biologically inactive things. And it's like all that shit in this one little pill. So obviously, if anybody recommends to you to get on Premarin, just run for the hills. I think that the other thing you look at with these productions of these hormones, especially Premarin pregnant mare urine, is where they got the word from. Obviously, horses were essential to the production, and they had to be pregnant because it came from pregnant mares. So at the time, there were 700 farms with about 80,000 horses producing urine, and the mares had to be maintained so that the urine could be collected properly. So basically, what they had to do was they had to get these mares pregnant and then not let them move around. They had to keep them where the urine could be collected. So they couldn't run around freely because they had to collect the urine. So they keep them in these corrals, pregnant, and just want them peeing all the time. And think about it, 80,000 horses were basically abused in the making of this medication. For some reason, we never said anything. So let's move on to progestins. Progestogens, also called progestogen, gestogen, gestogen, is a molecule which is synthetic, basically progesterone. It has similar effects as progesterone. It does bind to the progesterone receptor and acts as an agonist on that receptor, meaning it stimulates it. Progestins are synthetic progestogens. Not that you need to remember that. But anyways, there's different kinds. They call progestins generations. There's different generations. So there's pregnanes, medroxyprogesterone, which we talked about, which was in Prempro, and nomegestrol acetate. Sorry. Yeah. Nomegestrol acetate. Estranes, so that was a pregnane. These are estranes, norethindrone, which is in the mini pill, norethindrone acetate, ethinylestradiol diacetate, and norethindrogel. And then there's gonanes, levonorgestrel, which is the medication that is in the implants and IUDs, desogestrel, norgestimate, and gestadine. Progestins are used in medications that are primarily for contraception, either alone, like in the mini pill, or in combination with ethinylestradiol, like I just spoke about. They can also be used in the management of other conditions, which I don't recommend, but that's what my colleagues use them for. The contraceptive vaginal ring, transdermal patches. There is one called Combi Patch for hormone replacement. Combi Patch is bioidentical estradiol, but it's a progestogen. It's a synthetic progesterone. Then I think the worst drug ever invented of all time is Depo-Provera. Depo-Provera is a massive injection of medroxyprogesterone acetate, has tons and tons of side effects, was used in large doses to reduce endometrial and ovarian cancers, causes all kinds of other problems. I refuse to use it anymore. The indications for these medications, basically FDA approved for contraception, as I spoke about, hormone replacement. They're approved for bleeding issues and things like that. But they're used to treat, things like dysmenorrhea, painful periods, irregular periods, abnormal bleeding. They've been used for a long time to treat endometriosis-related pain. They can be used for amenorrhea in those patients who don't have periods. You give them progestogens for 10 to 14 days and withdrawal. And all of these things that I'm saying, I don't necessarily do these with progestogens, but I do them with micronized progesterone, the bioidentical form. So basically, the administration of these, as I talked about, there's IUDs, there's subdermal implants, there's oral, there's injections, so there's all different kinds. The contraindications for these medications: any factor that increases the risk of cardiovascular disease, blood clots in the legs, because they can coagulate. Now, these are when they're combined with ethinylestradiol. Progesterone only contraception, mini pill, which is norethindrone usually. Contraindications are, they're similar to the other pills, but obviously breast cancer, undiagnosed abnormal bleeding, liver tumors, cirrhosis, or liver disease, because again, these medications are cleared by the liver, especially when you take them orally. So the only synthetic progesterones that I will use are the ones in the IUD. I do find that the IUD is a good form of birth control for that woman that just, isn't really wanting to do more kind of like natural family planning. She doesn't have the time, but she still doesn't want to get pregnant. I think it's a good form of birth control, and it's not as systemic as a pill would be. So kind of the lesser of two evils. So we've looked at ethinylestradiol. We've looked at all the pregnanes and gestanes and synthetic progesterones. And guess what? The bioidentical hormones, there's only two. There's estradiol. Well, I'm wrong. There's four. There's estradiol, estrone, and estriol. And there is progesterone, micronized progesterone. With the estrogens, estradiol, estriol, and estrone. There used to be a product on the market, compounded, called Triest. Triest is an old version where all three of those hormones were together, all three of the estrogens in an 80-10-10 combination. Estrone they removed because it can turn into a carcinogenic form called 4-methoxyestrone. So that was removed about 10 to 15 years ago. So then we had estriol and estradiol in something now called Biest, because there's only two now. Biest I still see used a lot by people that aren't really in the know about hormone replacement. And the reason I say that is because when you use Biest, which has either 80% estriol and 20% estradiol, or 50-50, estriol is very weak. It's about 100 times weaker than estradiol, but it can bind the estrogen receptor in your body. So what happens is you have this estriol floating around, gloms onto an estrogen receptor, but it doesn't really do anything. So it's so weak, it binds the receptor, but it doesn't do anything physiologically. So the estradiol, the stronger of the two, can't bind onto that receptor. So sometimes when you're taking Biest, you're actually robbing Peter to pay Paul, and you're kind of contradicting what you're doing. And I just found that over the years of using Biest, that patients were coming in all the time and just not having the results that they wanted. And when I just switched to straight estradiol, things got a lot better. So the difference between synthetics and regular, well, this estradiol is the same estradiol you've had in your body since you were 12 or 11 or whatever age you started having periods. Topically, there is no increased risk of blood clots with this medication. So even in women that have an increased history of like factor V Leiden or blood clots, this does not increase the risk of blood clotting. It's been studied if it's used topically. It also, if used topically, doesn't have the conversion into 2-methoxyestrone. Now, some estradiol, if it's taken orally, will convert into estrone. It doesn't happen in a topical application. So that's why when I use estrogens, I always try to go topically first. The other thing is it doesn't go through the liver, so it's not taxing the liver, and you're not losing the dose to the liver. You know, when you give an oral application of any medication, you're going to lose some of that to the liver, and you're going to tax the liver. It's got to get rid of those medications. So I try to minimize that. So basically with hormone replacement, with estradiol, and that's what I would push for. If you're seeing a hormone provider who wants to put you on Biest, it just shows me that they just haven't read a study, that they haven't really looked at enough patients to know that it doesn't really work particularly well. And I probably would look for another provider. It's just old school. It doesn't usually mean a whole lot. And it doesn't do a whole lot. So I would stick with straight estradiol. Progesterone, or micronized progesterone, as I do this podcast, there is currently a national shortage. I don't know why, but I have a guess. My guess is all these damn companies that are popping up left and right as a predatory means to prescribe hormones. And what I mean by that is what they found, obviously, is that as the population ages, you guys are worth a lot of money. And so what's happening is this explosion of these telemedicine clinics where you pay a monthly fee, you might meet with somebody online, and they just write a prescription. Most of them don't do testosterone because it's a controlled substance. So I think you're wasting your money anyways, because probably 90% of you have low testosterone and probably need to have that replaced. But they're prescribing shit it shouldn't be prescribing. They're prescribing it in doses they shouldn't be using. And so you're seeing this explosion in prescriptions by these freaking pill mills, and everybody's running out of medication. I personally wouldn't support any of them. I've had many of them call, write letters, email, Instagram. They want to be on the podcast. No, no, no. F you, no. I think it's disgusting. Anyways, that being said, I'm not against telehealth, obviously. I just think the impersonal, hiring some person who has absolutely, look, I talked to a PA, a physician assistant. I interviewed her at my office. She worked for a company that was doing this kind of similar stuff, but with thyroid. And what she described to me made my toes curl. She just sat at home. She got paid based on the prescription number. So the more prescriptions she wrote, the more she made. The more patients she saw, the more she made. And she didn't really know anything about the patient. She just had a checklist of things she had to go through. And she was writing prescriptions. And obviously she was trying to get out of it because she felt worthless. She felt horrible because she's just part of this wheel, this cog in this machine that's just out there to make money. So please stay away from those predatory companies that you see on Instagram. Estrogen this, making false claims. Now Gwyneth Paltrow's starting a company and Halle Berry's got a company, and everybody's, any celebrity that's over the age of 50 now is finally coming to the realization that we need this, even though we've had it the whole time. They just weren't part of the party. But now it's super important. So micronized progesterone, there's a national shortage. I've got a lot of patients having a hard time. Keep in mind that if you're in that group and you're having a hard time finding your 100 milligram or 200 milligram dosage of progesterone, that you can still get it compounded at local compounding pharmacies. It will cost you. It's not going to be covered by insurance because it's compounded, but they have the supplies. What's happened, as I said before, the substance, the wild GM/soy that they make these hormones from is widely available, and they can make it in labs. It's just that the companies have these contracts with these big corporations to prescribe these 100, 200 milligram capsules. So it's running out. But you can still get it compounded. I'm calling compounding pharmacies all the time. They have plenty, and they can make it whenever they need it. It's just that it's probably $45 to $50 a month. So micronized progesterone is a diuretic. It upregulates GABA receptors in your brain, helps you sleep, calms you down, gets rid of some anxiety, gets rid of some edginess, and basically just makes you feel a hell of a lot better and calmer. Progestins, synthetic progestins that are in birth control pills, mini pills, implants, IUDs will not do that. They will not give you that effect. I had women that have anxiety and other issues, and the doctor said, we'll put you on the mini pill. It's not going to do a damn thing because the mini pill doesn't upregulate GABA receptors, and it doesn't help with anxiety. You have to be on a bioidentical progesterone for that. The only form of testosterone, we'll move on to that real quick, that was available years ago for women was a product called Estratest, which was a combination of Premarin or equilin, conjugated equilin, and methyl testosterone. Methyl testosterone, oral testosterone, in the methylated form is horrible. You shouldn't take it. It is stressful on the liver. It has a lot of side effects, very potent and powerful. Bodybuilders used to use it years ago, cause all kinds of liver failure and liver problems. So anything with methyl testosterone in it, you want to stay away from. Testosterone, as a bioidentical hormone orally, if you take it orally, and I usually don't use it orally, but if it's taken orally, can cause, it actually is absorbed by the lymphatic system, not into the bloodstream right away. So It doesn't have the liver first pass effect. So actually, if you needed to take it orally for whatever reason, you can. That being said, injections for any hormones is crap. Pellets are obvious crap, as you are all aware. What I have seen is a resurgence or a surge in the number of patients that are getting injections of estrogen and testosterone. Why? Money. It's the only reason they're doing it is money, because you have to get the medicine from them. The problem with an injection is you got to do it like at least 2 or 3 times a week, because it's not going to last. I've had patients that are getting a sub-Q injection once a week. Well, that doesn't do shit. It lasts in your body for probably 2 days and then it's gone. So what's the freaking point? Then you've got doctors doing twice a week. Now that's a little bit better, but what happens is you're going to get a peak. It's going to slide way up, it's going to peak, and then it's going to fall to the ground, and then you're going to do it again. And it looks like a sawtooth, a little sawtooth pattern compared to the bigger sawtooth pattern that you see with pellets. Injections and pellets are horrible ways to replace hormones. Don't do them. The people that are doing them don't know what the hell they're doing. All they're thinking about is the monetary gain. These are not approved methods to replace hormones. There are many, many other successful ways to do hormones. You don't ever need to do injections. And for the woman that's going to come back to me and say, I feel amazing on my pellets. Okay, you feel amazing on cocaine too, but you probably don't need to take that, do you? And here's the other piece. If you have a headache and you take 2 Motrin and your headache goes away, do you need to take 20? No, the headache will still go away and you'll feel amazing, but you just crushed your kidneys because you took 20 Motrin. It's the same thing with pellets. You don't need a bazooka to kill an ant, which is what they're doing with the pellets. They're shooting you with a bazooka when you just don't need that much. So keep that in mind. Synthetic hormones are made. Bioidentical hormones are made. The difference between the two, synthetic hormones, when we use those in the realm of integrative, functional, I would say normal medicine, synthetic to me means they don't look like your body's natural hormones and that they were made in a lab. Things like ethinylestradiol, levonorgestrel, levonorgestrel, medroxyprogesterone, because they got weird names attached to them. If you look at the name and it looks like something funky, then it's synthetic because it doesn't say estradiol or progesterone. If it says methyl testosterone versus testosterone, you know it's synthetic. Don't take it. So anything you can't pronounce, don't use it. It's the same when you read a package on a box of food. If you can't read all the shit, I mean Cheetos, come on. Cheetos are good. Yeah, I'm going to get yelled at for that. But anyways, remember that. If you can't pronounce the hormone, don't use it. I want to thank y'all for listening. Keep asking questions on Saturdays. Love you all. I'll see you on the other side.